Good evening, listeners. Welcome to another episode of our special segment on 100-Day TB Elimination Campaign. We are taking a deep dive into one of the most important public health efforts currently underway in India, the 100-Day TB Elimination Campaign. While the campaign's goals are clear and its actions are far-reaching, the path to a TB-free India is not without its challenges. Today, we will be addressing the obstacles and hurdles that have emerged, whether it is related to awareness, access to healthcare, or community engagement, and how these challenges are being made with innovative solutions. We will also look at the outcomes so far and assess the real impact this campaign is having on fight against tuberculosis. We are once again joined by Dr. Vezokholu Theyo, State Program Officer of National TB Elimination Program, Directorate of Health and Family Welfare, Government of Nagaland, who will provide us with an in-depth perspective on the difficulty faced, the strategies implemented to overcome them, and what we can expect moving forward. Stay with us for a candid conversation about the realities of this critical campaign and how, despite the challenges, India is moving closer to its goal of TB elimination. I am Asonyo, your host for the program. So my first question to you, ma'am, is could you talk about the role of the healthcare workers and the challenges they face in treating TB, particularly during this campaign period?
With regard to the National TB Elimination Program (NTP) and the 100-Day Campaign, healthcare workers are responsible for ensuring symptomatic and all MAP vulnerable population, including people in congregate settings, to undergo screening and testing. Then appropriate treatment management is initiated for those eligible. Adherence to treatment, follow-up of the patient, ensure NPY Ni-Kshay Yojana benefits are paid, and the food baskets are distributed through the Ni-Kshay Mitra. Ensure all patients are risk assessed and referred to appropriate facility. Conduct verbal autopsy and maintain death records. Monitor daily of campaign progress through real-time data analysis and address any gaps in operations promptly. And the challenges are, what we have seen is delay in health-seeking behavior. As I have told earlier also in our previous discussion, the ignorance. So we are going to face one of the challenges that. Then stigma to TB, though it is improving, it still exists in the community. Then incomplete diagnostic algorithm due to limited X-ray and diagnostic capacity. Delay in treatment due to delay in diagnosis. Paying attention to the following after diagnosis of TB for differentiated TB care services in HIV, the diabetic status, then family members, close contacts, co-workers, congregate settings. We have already focused these challenges, and especially during this campaign, this is expected, but we are prepared for it.
Ma'am, as the State Nodal Officer for the National TB Elimination Program, I'm sure you have faced some obstacles as you yourself have been going to district and campaigning for this program. Can you also highlight some of your biggest obstacles that you have encountered during the campaign so far, and how are they being addressed?
One of the main strategy of this campaign will be screening with the handheld X-ray and upfront net testing. So this upfront net testing, it's for the district of Mon Wokha and Kohima, is not an issue. But here screening with X-ray. For the district of Kohima, we have a handheld X-ray. We have started using in the facilities. But in the district of Wokha and Mon, handheld X-ray, that is ultra portable X-ray machine, handheld. So these are machines which have inbuilt intranet, and it has AI solution. Okay. So you take an X-ray, that interpretation is given within a few seconds. So this screening, to overcome this obstacle, we are hiring one digital ultra portable handheld X-ray for Mon and Wokha. Okay. So it is expected to reach us by the 10th of January. Okay. As for Kohima, we have from this Clinton Foundation, already is in place and we are using. The molecular diagnostic testing capacity in the district of Mon Wokha and Kohima, the district are equipped average of 2 net machines are there. However, we are trying to relocate some more machines from the other district which are used during the COVID, the TrueNet machines. Then the public participation and mobilization of this vulnerable population. There is low participation of the health staff in mobilizing community as well as public participation due to the ongoing festive seasons. So when I say the health staff is the community health officers, the ANMs and ASHAs, because of the ongoing festive season, but it will pick up in the days to come. So enhancing awareness generation and IC activities are being planned post-New Year.
Ma'am, you have earlier mentioned that stigma still continue to prevail in the community. So how do this stigma and misinformation impact TB efforts to control the disease, and what is being done by the government at the state level or the national level to tackle this problem?
Yeah, the most common cause of TB stigma is the perceived risk of transmission from TB infected individuals to susceptible community members. When TB is stigmatized, the fear of the social and economic consequences following diagnosis can make individuals reluctant to seek and complete the medical care and therefore substantially impact the health. And TB is also stigmatized because of its association with HIV, poverty, low social class, malnutrition, or disruptible behavior. So the effect of TB stigma on TB diagnosis and treatment, we can see to few points here. People with TB symptoms may delay seeking help due to fear of discrimination, which can lead to more serious illness and thereby spread the infection to the household context or the neighborhood. Because a person who is positive for TB, if not treated, can infect 10 person in a year. Then TB stigma contributes to delay in TB diagnosis and negatively impact treatment compliance and can lead to drug resistance. At-risk individuals report that fear of TB stigma and the social and economic impact of stigma affects their willingness to undergo TB screening and to seek medical care after the onset of symptoms associated with TB. Individuals with TB-like symptoms may first attempt to seek private physicians so as to avoid TB stigma, but this may translate to increased financial costs for patients. Then, individuals with TB and their healthcare providers also identify TB stigma as a cause of non-completion of treatment. The consequences of TB stigma may lead individuals to drop out of treatment programs. Stigma can lead and perpetuate myth about that TB treatment causes death. Stigma can lead to social isolation and other negative impacts on the life of people with TB. So these are the effects of TB stigma on TB diagnosis and treatment. But we also can look into the interventions to reduce TB stigma. TB education support programs aid at healthcare providers, individuals with TB, and at-risk community members may reduce the stigma. Empowering individuals with TB to resist stigmatized external judgment while working to change the community norms about the disease. For example, a TB champion or a TB survivor plays a role model to offer social support, encourage TB screening, treatment adherence, and monitor for treatment side effects. Reduce social isolation and offer an environment which TB status is highly visible and accepted. Reduce the negative attitudes and practice concerning TB. Also, community engagement activities involving communities in TB forums, conducting sensitization programs, community meetings. This helps to reduce stigma. Protecting the confidentiality of TB test results and patients' anonymity can help to reduce stigma. So, the interventions and the effects of TB stigma, these are the few points.
So, ma'am, I also wanted to know what is the current situation with regard to multi-drug resistant TB and how is the campaign addressing to it?
Yes, this drug resistance emerges when TB medicines are used inappropriately through incorrect prescription by healthcare providers, poor quality drugs, or patients stopping TB treatment prematurely. Here, TB do not work with the two most effective first-line TB drugs. But MDR-TB is treatable and curable by using other drugs, which tend to be more expensive and toxic. In Nagaland, of the notified TB patients, about 3% are multi-drug resistant TB. The campaign will intensify the existing effort by ensuring early detection of drug resistance using this rapid molecular tests and line probe assay. Then prompt collection of quality sputum and transport to the nearest TB detection centers. Then reducing diagnostic and treatment delays, treatment with government-approved quality drugs, management of adverse drug reactions, patient-friendly treatment regimens, including newer, shorter oral regimens, which the program is having. Earlier, for multi-drug resistant treatment, the treatment is given for 1.5 years to 2 years. Then it is reduced to 1 year to 9 months. And of recently, we have BPAM, which has come in, where the treatment will be just for 6 months for drugs combination. So, it is important that once TB is diagnosed and treatment is started, we should encourage the patient to complete the treatment. Because of faulty treatment, dropouts, no proper follow-up, then this emerges drug-resistant TB, which is avoidable.
Since the launch of this campaign across the states, what tangible outcomes or successes have been achieved so far during this campaign?
Yeah, since the launch on 7th December, the report which have as on 22nd December 2024, we have conducted 22 camps across Mon Wokha and Kohima. 6 vahans utilized, 2 each per district. The vulnerable population screen is 896. Enrolled in Ni-Kshay is 267. Screen with X-ray is 113. Tested with the upfront molecular testing, that is NAT, for TB diagnosis, 131. And of the total diagnosed with TB is 4 patients. So these 4 patients have been put on treatment. They have been linked to NPY, Ni-Kshay Pojan Yojana, and Ni-Kshay Mitras have been connected with them to get the food basket.
Ma'am, I'm also curious to know, since you have mentioned Ni-Kshay Poshan Yojana, what kind of diets should a TB patients follow?
We look into the protein diet. So in the food basket, we are including egg, which is a very good protein. Then we are including pulses. Those are the main items which we have included along with milk. So for the food basket, we are including those for additional nutritional support.
Before we wind up our episode, what message would you like to share to those who are unaware or hesitant to seek help for symptoms of TB and encourage them to come forward for testing and treatment? And if there are some such percent, are there any testing available for free in the government health centers?
Under this National TB Elimination Program, all testing and treatment, it is free. For this campaign, our expected output is to look out for the missing cases, because this campaign will impact positively towards the overall goal of reducing mortality and morbidity. So the high burden areas and vulnerable populations have been mapped, then intensified case finding of the symptomatic among the general population and symptomatic and asymptomatic of the vulnerable population, that is those above 60 years, malnourished, diabetes, HIV, smokers, alcohol, household contacts of TB. Then the screening with the handheld X-ray and upfront NAT testing and scaling up of preventive TB treatment. These are focused to reduce the TB incidence. And on the other strategy is to reduce TB mortality. So for early detection and appropriate treatment, whether it is drug sensitive or multi-drug resistant TB, then the differentiated TB care approach for the treatment of comorbidities, that continuous monitoring during the treatment will be there. Detection and treatment of comorbidities of kidney, liver, heart, diabetes, cancer, HIV, TB death or deaths, and the nutritional intervention, rupees 1,000 through direct benefit transfer for the period of treatment, 1,000 per month, and that expanded scope of Ni-Kshay Mitras to cover household contacts. Then nutritional supplement to TB patients whose BMI is less than 18.5. All these are in the pipeline. And for those who are unaware or hesitant to seek help with symptoms of TB, the message which we would like to give is across the state, we have the district TB centers. We have 53 diagnostic and treatment centers, and we have 22 tuberculosis units. Then we have NAT machines for testing, and free TB quality drugs are available in all these centers, at the district TB centers, also at the tuberculosis unit, which are there at our community health centers, CHC, and as well as PHCs. And besides these diagnostic and treatment centers, which are also our microscopy centers, we have also brought in a few PHCs as our microscopy centers. So these drug boxes, once a patient is diagnosed with TB, the drug boxes will be made available at any health centers where the patient is residing. So across the state, we have 318 health and wellness centers, sub-centers, 49 Ayush health and wellness centers. So in all this, wherever the patients are located, treatment can start at those health facilities under the supervision of the community health officers or nurses, or which are not health and wellness centers. If it's just a sub-center also, our ANMs are there, they can provide the treatment. And for those facilities which are far away from district TB centers or the diagnostic centers, the ASHAs are involved for sample transportation. So under this community TB support, we have this scheme, Ni-Kshay Poshan Yojana, where for treatment supporters also, direct DPT also is available. Yes. Then patient informant. You bring a patient who is having cough, fever, loss of appetite, the symptoms of TB to a center for testing. And if that patient is diagnosed with TB, as a patient informant, 500 rupees will be given to that patient. Okay. Treatment supporters, also they can avail this NPY. Okay. All these are there under the program. There's no shortage of fund for this NPY. They can avail those. Those who are unaware and hesitant to seek help, especially in this high burden district of Mon Wokha and Kohima, anyone having the TB symptoms, which we have already discussed, can visit the district TB centers or the diagnostic and treatment centers in the district. So the information you can get from the ASHAs or the CHOs, the nurses, the medical officers, referrals can be done.
Well, that was a very insightful information that you have given to us. Those who are yet to come out from their comfort zone in testing TB, I'm sure they will be able to come out freely. We all know that TB is treatable.
100% curable.
Yes, yeah, 100% treatable. And thank you so much, ma'am, for sharing your valuable insights into the challenges and outcomes of the campaign. It is clear that while there are significant obstacles such as stigma, awareness gaps, and access to healthcare, the collective efforts of community healthcare providers and local authority is making a real impact. The journey to a TB-free India may not be easy, but the strides we have already made show that it is possible. For increased awareness to enhance diagnosis and treatment, we are moving in the right direction. To our listeners, this is a shared responsibility. Every action counts, whether it is educating others, supporting those in need, or simply being vigilant about symptoms. Let us stay engaged and work together to ensure that we meet the goal of a TB-free India by 2025. Thank you for tuning in, and remember, together we can overcome any obstacles in the fight against tuberculosis.